Hello, and thank you for joining us for our live Q&A about COVID-19 vaccinations for young children. Today, I'm joined by two of our experts here at UI Healthcare, Pediatrician and Division Director of Pediatrics and Adolescent Medicine, Rami Boutros, and our Chief Pharmacy Officer, Mike Brownlee. They will both be sharing information and answering your questions about the COVID-19 vaccines that were recently authorized for kids who are 6 months and older. Please submit any questions you have for them now, and we'll answer as many as we can. Just a note before we begin, this broadcast is for informational purposes only. If you or your child are feeling sick or are concerned about your health, please contact your primary care provider. Thanks for joining us today, Dr. Boutros and Dr. Brownlee.
Thank you.
Thanks, Emily. It's great to be here.
All right, let's jump in. We're going to start today with some background for our viewers. Dr. Brownlee, could you recap what COVID-19 vaccines have been authorized for kids, including the most recent authorization for young children?
Yeah, you bet, Emily. It's hard to believe, but the first vaccines for kids came out almost a year ago, actually a little over a year ago. Last May of 2021, the COVID vaccine from Pfizer was approved for kids that are 12 and over. And then in November, it was approved for kids 5 to 11. So those are both Pfizer. Most recently, actually last weekend, the CDC signed off on the FDA approval for Pfizer for kids 6 months through the age of 4, and then for Moderna vaccine for kids 6 months through the age of 5. Actually, this morning, the CDC actually signed off on the Moderna vaccine for ages 6 through 17 for Moderna. So now for both vaccines, the Pfizer and Moderna, both are approved from 6 months and up. So that's what's available for kids right now for the mRNA-based vaccinations.
Thanks, Dr. Brownlee. It's exciting to see the progress. Dr. Boutros, who is recommended to receive the COVID-19 vaccine?
Thank you, Emily, and thank you for inviting us. Right now, all our pediatricians, the American Academy of Pediatrics, recommend the use of this vaccine for children, younger children, through adolescence. And it's been a great step, as Dr. Brownlee said, about getting the vaccine recently. I wanted to tell families that any vaccines over the years I have been practicing, they go through a lot of rigorous process to come on the market. Before we recommend them to our families, there is a lot of analysis, studies that has to be done, and the studies finally showed that COVID-19 vaccine is safe and effective in this age group. And I'm very excited for my own patients to have it available, that they are able to receive it. And I've seen the excitement on many families that this is available now.
Thanks, Dr. Boutros. And I know we'll be talking a little bit more later on about the authorization process for this vaccine as well. So Dr. Brownlee, if parents are interested in having their child vaccinated, when and where will they be able to receive vaccines for their kids?
Yeah, we started providing the vaccine this Wednesday. So we opened up some slots at 7 o'clock in the morning, and they were filled almost immediately. So those vaccines are being provided at our Iowa River Landing location in Coralville. And we're starting there because it's a new vaccine. We want to make sure we do this right. We're keeping it just in one spot for right now, so that our staff can be accustomed with the new doses, provide a comfortable environment for the patients to receive the vaccine. So we opened up appointments online. So all of our appointments can be scheduled through MyChart. So if you have a MyChart, that's our electronic health record connection into UI Healthcare. You can schedule through MyChart. You can also come in through uihc.org and schedule an appointment that way as well. I think we've put both the links in the comment section too, so you can easily link into how to create a MyChart account, so you can be connected into UI Healthcare that way, or you can come in through our web portal as well and schedule an appointment. We're planning to expand our vaccination next week into additional locations. We have pediatric clinics in other counties. We have others here in Johnson County, for example, in North Liberty at Scott Boulevard, Peds Associates. So we're looking to expand, but we're going to do that after we have a chance to get used to using the vaccine and to make sure that we create a great environment for our patients and families. The last thing I would add is we know that our colleagues in the community are also providing vaccination. From what I understand, Mercy Pediatrics, Towncrest Pharmacy, other pharmacies like Walgreens and Hy-Vee will also be offering the vaccine as well. So it's not just UI Healthcare. Our goal is to make sure we get kids vaccinated. And we're an offering here in the Iowa City, Coralville, North Liberty, the corridor area, but there will be others. One thing to note is some pharmacies will only offer it at the ages of 3 years and up. And there's some limitations from what age ranges pharmacists can give vaccines. In the state of Iowa, pharmacists can give doses to kids that are 6 months and over. But you'll see some variation there with ages where they're offering the vaccine. But we've got slots that are open, and we're excited to be able to offer it to the community.
And Emily, to add to Mike's, also as the kids comes for their own appointment, and they have also scheduled for vaccines, we are able to offer them at the same time. There is no reason not to be able to administer both the regular vaccine as well as the COVID vaccine. So definitely, if also they have an appointment already scheduled, that's a good timing also to chat with their pediatrician and get the vaccine administered.
Thanks, Rami. That's a really good point. I think just continuing to emphasize to keep kids on their regular vaccination schedules. I'm glad you brought that up because the COVID vaccine can be given at the same time as other vaccines. So thanks for bringing that up. Really good point.
Thank you both. So I know a lot of people have been wondering, about this next question. Why should kids be vaccinated against COVID-19, given that the risk of hospitalizations and death from COVID-19 is low in children? Dr. Boutros, if you want to start with this one.
Absolutely. I thank you for bringing this question up. We know that probably kids are less likely to get sick from COVID-19. However, still there is the risk and the severe disease in certain children. And we have seen some of the children get hospitalized, as well as the potential for bad outcome for these. And does not mean that the child need to have a underlying illness or chronic issue to get a bad disease. The other part, which is very important, kids can pass the virus to others. That's including their caregivers in daycare, at home, to the grandparents. So we always, I think, very important to immunize them, so to decrease the spreading of the virus, as well as to protect them and keep them healthy. And we don't want kids to get hospitalized. Just to give our audience some perspective, and I'm going to use some numbers. There was over 2 million cases of COVID-19 in this age group. They contributed to almost 20,000 and more of hospitalization. And the bad part is there was over 200 cases of death in younger children. These are preventable. And for me as a pediatrician and as a parent, this is the hardest part of it. And I encourage our families to consider the vaccine because we want to minimize the risk of any severe disease and any hospitalization. And that's the benefits of the COVID-19 vaccine.
Thank you, Dr. Boutros. So we're going to shift gears here a little bit and talk more about the authorization process. So it's been more than 7 months since vaccines were authorized for the 5 to 11 age group. What happened during that time that led to this recent authorization for kids under 5?
Yeah, that's a really fair question. And we know it's been hard for parents that have been waiting to get their kids vaccinated and to protect their whole family. There was some news that came out in January about the potential for Pfizer vaccine to be approved. It was halted because of some questions about the study, and I'll answer some of those questions here in just a second. I think Dr. Boutros made this comment earlier that vaccines released in the United States go through a very rigorous process for approval. They're tested, there's analysis, there's review, there's review by independent advisory committees of the CDC and FDA. So I think the public should feel comfortable knowing that there is a very rigorous approval process. So in the case of Pfizer specifically, what was found by Pfizer when they looked at that data for the 2 doses of the vaccine that was to be approved, it was not meeting the standard of creating the immune response that they had expected, that they knew that the FDA was expecting as well. So the trial was changed at that time to add a 3rd dose to make sure that kids were getting the immune response that they needed to be able to fight the virus. The doses that were approved are less than what they were in the ages of 5 to 11. So it's a process that most drugs and vaccines go through that's not known by everyone in the lay public, but this is a very common process of trying to find out what's the right dose of the vaccine that produces the immune response that we need it to while minimizing the side effects. So when we look at that from a scientific perspective, everything that happened from January in this approval process was pretty standard. So Pfizer came to market or brought forward data for 3 doses instead of 2, and that's why there was some delay with the Pfizer study specifically. Moderna was still collecting data at that time for their kids 6 months and over, and their approved 2-dose series came from that data that was collected throughout the winter in the Omicron phase. So it takes time to evaluate the data, to complete the study, to enroll enough subjects into the trial so that we can measure the impact to make sure that it's safe and effective. So we know that there was a wait. We know how hard it was to wait for the vaccines to become approved and be able to be used starting this week. But it's a science-based process that was followed by the FDA, the CDC, by Moderna and Pfizer, both specifically. So we know it was a long process, but I think everyone should feel good that a process was followed that was consistent with all the other vaccine approvals that have happened.
And Mike, I think to your point, I know it's felt a long time, but over the last many years and seeing the different vaccines that we have brought to the market, we have done a lot of enhancement on the way we develop vaccines that we were able to bring it in sooner than what we've seen with other older vaccines. And I will tell you, over the last 30 years, I've seen a lot of changes and a lot of improvement, and especially on the safety piece and the side effects from the vaccine. So I want to tell the families that although some people might think came also fast, it's because of a lot of development that happened over the years that allowed us to do this and do this safely and effectively.
Great point. Great point.
And just to follow up to that, what does the research say about how effective the vaccine is for this age group?
Yeah, I'm going to add to what Dr. Boutros just said about the way these studies are designed and how they came to market. That there were thousands of kids involved in the trials to make sure that it was understood how it would impact kids. In the first piece of that, the way that was studied was to try and find the right dose. So finding the right dose that produces the immune response that is expected and minimizing side effects is the first thing that happens. The second, with the approval of these vaccines, was to make sure that that immune response matched what we had already seen. So fortunately, we've given this vaccine to hundreds of millions of individuals. And so comparing the immune response between the kids and an older age group, it was much easier to do. And that part of the study is called immunobridging. And so that was a key part of what was able to bring these vaccines to our kids. Third, then they measured the efficacy or the vaccine efficacy. So for Moderna, it was around 44% to prevent symptomatic illness. For the Pfizer trial, it was 80%. But I will say that with a caveat that it was a low number of patients, so it's still being evaluated. But when we look at the safety and efficacy of these vaccines, they're being shown to be very safe. Very safe side effect profile, very low number of side effects. And I think Dr. Boutros can speak to that even more. that we're expecting to see in kids. But overall, the efficacy for these vaccines is mirroring what we were seeing for adults during the Omicron phase. So very encouraging news about the immune response that the vaccines have provided, low side effect profile, and we're studying even further how it can prevent serious illness, hospitalization, and death. And that's primarily what we're looking for with these vaccines, is to help do that. We see that with the flu vaccine. There are years where the flu vaccine is in the 40% effectiveness range, but it's definitely helping to prevent serious illness, hospitalization, and death. So I think we're seeing what we expected. We're very encouraged by the data. And there will be continued testing, analysis of the efficacy of these vaccines. But there's no time in history there's been more focus in having more data on a specific type of vaccine than what we're seeing now. I mean, with so many individuals receiving it and so much research being done, I think that's a definite benefit that we're going to see and be able to study even further the impact of these vaccines.
Thanks, Dr. Brownlee. And that segues nicely into our next question, really kind of focused on the side effects of the vaccine. And I know that's another thing that people are asking a lot about. So Dr. Boutros, can you talk to us about the possible side effects of the vaccine and if there's any risk of significant side effects like myocarditis?
Absolutely. I think as I look on the vaccine and comparison to others, the major things what we've seen is more local. So a lot of the kids, the potential for pain, soreness around the site of injection, redness, that's what we have seen. Some children, similar to adults, might develop some like flu-like symptoms, usually around a day or two, then resolve on their own. I will tell you, and seeing the even the older kids, really I seen a lot of kids with no side effects and no issues with the vaccine. Um, Definitely, the one thing that worry many of our families and ask about is the myocarditis and pericarditis that's seen with teenagers and others earlier. Those are not seen with this age group, mainly reported in earlier with the Moderna age 18 to 24 and Pfizer 12 to 17. But even those were very short effect on the kids with the care of providers. Really, kids returned and recovered very quickly. So even those were very minor. So I want to assure the parents is this vaccine, the side effects we are seeing very minimal, and I don't see it any major difference than what we have seen with other vaccines that we administer.
Hey, Rami, just a quick point to make too. For those kids that are 6 months to about 2 years old, they're not able to verbalize their side effects as well. Is it true we'll see kind of sleepiness, irritability? What are your recommendations for the side effects, or what are you going to see in those younger kids?
Yeah, and I think this similar. Thank you, Mike, for mentioning that. Usually, in the 6 months, I tell parents to look for irritability. The child uncomfortable seems like when you touch the leg is uncomfortable with that, and in these circumstances, we'll advise something like Tylenol for these circumstances. Again, I think. Back to the previous point, in comparison over years, I seen less and less side effects than what I used to see earlier days in my practice. And that's because of the advancement, and we take a lot of these into consideration. I still will say if you see your child having a little bit of fever, irritability, that's not out of the normal for what's expected with these vaccines.
You also said one more thing that triggered my mind when you said Tylenol. It is acceptable to give, if the child's able to receive Tylenol or ibuprofen, but to give it after the administration of the vaccine. It's not approved or recommended for those to be given before the vaccine. So is that what you would recommend, Dr. Boutros?
We used to say give these in proactively. I tell parents, sorry, I wait and see because many kids are not exhibiting any symptoms. So I encourage the parents, if you see these symptoms, go ahead and treat. Otherwise, if the child is doing well, it's really is not needed.
Thank you.
Did that answer your question, Mike?
Yeah, definitely.
Thanks for clarifying that. I think that provides, some great perspective on what to look for with side effects and how to manage those. So if you're just joining us, we're here with UI Healthcare pediatrician Rami Boutros and Chief Pharmacy Officer Mike Brownlee discussing COVID-19 vaccinations for kids ages 6 months to 4 years. Let's take a look at some of the questions coming in from our viewers. We have a question from Tanya, and she asks, will the vaccine be available in the neonatal ICU?
I can help answer that. The short answer is yes, it will be. We're working right now to make it operational in the hospital. I mentioned earlier during the broadcast that we're still working our way through understanding the best way to administer the vaccine. We're doing it mostly in the outpatient setting, and our intent is over the next week be able to also offer it to hospitalized patients as well. So it's complicated because there's so many versions of the vaccine that are available now, and we're trying to make sure we do it the best way we can. But yes, our intent is to be able to offer it to those that are in the outpatient setting and if you're in the hospital as well.
Great, thank you. Dr. Brownlee, will kids ages 6 months to 4 years old receive the same vaccine that was authorized for older kids and adults?
Yeah, that's a good question. It is exactly the same vaccine, just in a lower dose. So both Pfizer and Moderna, when they studied the vaccine for kids 6 months up through the ages of 4 or 5, the dose was reduced, but the vaccine itself was not changed. So for Pfizer, the dose is now 3 micrograms. In the 5-year-old to 11-year-olds, it's 10. So it's quite a bit less. In Moderna, they're giving a 25 microgram dose instead of 50 for those that are ages 6 and up. You shouldn't really think about how much it is or what the dose is. Just know that it is age specific, and so we're going to give the right dose for the right age. And the vaccine itself really has not changed at all. It's just the dose that we're giving to the child.
And to follow up to that, how is the COVID-19 vaccine administered to kids that are under 5?
Yeah, kids under 5 can be a tough group to vaccinate. And I think Dr. Boutros can speak to that in detail. But we want to provide a really quiet environment, use distraction techniques. If you've ever heard of a buzzy, to help reduce the pain at the injection site or to distract the patient so that they're comfortable. And for kids that are 6 months up through 3 years old, we'll primarily give it in their thigh area. And there are some variabilities with that too, depending on the size of the child and the person who's giving the vaccine based on their experiences. But for those over the age of 3, typically it's in their arm, the deltoid muscle, where we'd normally give a vaccine to older kids and to adults. So like I said, sometimes it varies based on the situation. But the thigh the vaccine itself is going into the muscle, and the thigh can be much easier and have more muscle than the arm. So for those that are 6 months and up through 3 years old, it's a lot easier. So Dr. Boutros, anything to add to that about the administration location of the vaccine?
No, I think Mike, you highlighted very well. I think it goes also to comfort with the child and the family. Definitely the younger age is going to be more in the thigh. As the kids get older, some of the kids come in and they are tough and they want to do it in the arm and they don't want to see in the leg. We work with them. We want to make sure that it is administered appropriately. And please don't hesitate to ask our team if you have any question. We are here for you. Sometimes it's just if you're wondering, please, we are happy to explain it. We want to make sure you are comfortable with the administration.
Thanks, Dr. Boutros. And just to kind of follow up with that, lots of children struggle with fear and anxiety about vaccines, especially this young age group. So what tips do you have for parents to help alleviate that fear and anxiety in their children, or just different tips or the distraction techniques that we might offer to help with that?
Um, uh, it's an excellent question, and I think it is very important for our families to know that we do our best to make it comfortable. The first thing I will say with older kids, please talk to your child before you bring them in. It is the hardest part when they walk into the door and then they know that they are receiving a shot or an injection. I think it is good to prepare them. In the younger age, it is very hard to prepare them for that. However, we use a lot of distraction techniques. As Mike mentioned, the buzzy, trying to do some coloring, some charts to look at, trying to work with the kid to sing, to do something. I encourage families also to bring a book that the child like to read while they are getting that, or even considering if they like a favorite video or something on their iPad or on the phone to allow them to watch it during that. Anything we can do to minimize that. The buzzy is one area we are doing, as well as we do a numbing medication that we do a spray to allow to minimize the pain. We look on all these aspects. I think a lot of times there is fear. Are we using a big needles or something? We use appropriate size needles to administer the vaccine. Our goal also to minimize the pain for children. We want them to feel comfortable coming to the doctor. So I think my comment is please, if they are older kids, talk to them. Let's establish a plan about things that will help them when they come in. But don't hesitate to ask our team, and we are going to be offering the same things when they come in is about potential ways to minimize the effect. And I think we have some information that we can share with the families on our podcast.
Thanks, Dr. Boutros. I'm sure that's reassuring for parents to know that the process can be made a little bit easier for them and their children. So should kids get the vaccine if they were previously diagnosed with COVID-19 and have recovered? Dr.
Um,
Boutros?
I think this is a wonderful question, and the short answer from my perspective, yes. And I think the reason for that, we want to build long-lasting immunity. When kids get the disease, we know that the immunity might be short, and we want to give them something that it will help them protect them long term. So I do recommend for the families to go ahead and get the vaccine after the child has been recovered. Some of the kids we know that probably, or in general, probably the immunity will be for around 90 days. But I don't like to wait until the end to try to give them the vaccine. I think we want to build on what start. Uh, Patient get the immunity from two ways, either the vaccine or the disease, but the short one is from the disease. We wanted to build the herd immunity, and the more we vaccinate, we decrease the circulation of the virus in the community and will allow us to overcome the pandemic. So my recommendation is go ahead and schedule that time. It does not mean that you have a rush if they are recovered today, that you need to go today to do it. You have a little bit of time, but don't delay it too long.
The
Mike,
only, the only thing I would add to that, Dr. Boutros, is, when can you receive it after you've been ill? And it's really when you're out of the isolation period and your symptoms have resolved. That's the soonest that you could receive it. So, so if your child is ill now, then wait till that they've recovered, and then we could schedule it potentially. But like Dr. Boutros has said, if they've been ill, there's no need to rush out and receive it immediately. We're here for you, and we can get that scheduled.
Thank you. And that's a great reminder, too, that the vaccine will provide that long-term protection. So, Dr. Brownlee, both the Pfizer, BioNTech, and Moderna COVID-19 vaccines are mRNA vaccines. Could you explain what that acronym means and how these vaccines work?
Yeah, it's so hard to understand how the vaccines work, and these are new vaccines. We didn't have them before. And so I'll just try and break it down in the simplest way that I can. So the M part of the mRNA stands for messenger, and then RNA stands for ribonucleic acid. And the way we want you to think about this is that the messenger RNA is really a recipe. So think of it as a single strand or a ticket of a recipe that goes into your cell and tells your body how to make a protein. That's basically all this does. And when it's used to make that protein or tell your body to make a protein, it goes away. And then what's happening in creating immunity for COVID-19, what happens is it creates that spike protein. I'm sure you've heard about that. So the mRNA vaccine helps your body create the spike protein. And then once that is shown to your body, it starts to create antibodies or an immune response. So really what's happening is these vaccines are trying to teach your body what it looks like so that you can create antibodies to it. And to Dr. Boutros's point, once you introduce this several times spaced out in a certain way, it's teaching your body over and over what that looks like and how to fight it off. And so that's a simplistic way to think about how these vaccines work. But it's not the first time we've ever looked at mRNA-based treatments, therapies, or vaccines. They've been studied for decades. And I think when the pandemic hit and resources were made available to study this even further through Operation Warp Speed and to really push the creation of vaccines, that was the catalyst to get them more advanced and to be where we are today and using them as vaccines. We put a link in the comments. We have an international expert here at UI Healthcare. Her name's Dr. Patricia Winokur, Pat Winokur, and she does a great job further explaining these types of vaccines. But we're grateful to be in a position today where we have advanced technology like mRNA-based vaccines that have really helped us to save millions of people's lives, reduce hospitalization, serious illness and death, and protect our communities and our families.
Thanks for breaking that down for us. If you're just joining us, we're here with UI Healthcare pediatrician Rami Boutros and Chief Pharmacy Officer Mike Brownlee, discussing COVID-19 vaccinations for kids ages 6 months to 4 years. We have a question from Amber that came in on Facebook. Do you recommend Pfizer or Moderna? Is there a preference for one over the other?
So I'm gonna start, and I will let Mike. I think my recommendation is get the vaccine, whichever formulation. I think if we look to comparing them head to head, I think the data right now is not complete to say one is better than the other. We know both of them effective. Both of them will help the children. There is a little bit of variation between the two for the number of doses, but I think either one will help protect our children. And my advice is whatever if available in your community. If there is one things, I will go with that. If there is an option, sometimes families has been and the people I talk to, dependent on what they receive themselves. They prefer to go with the same brand. There is many things to play in their mind. I think from my perspective, if you have concerns, probably the best person to be in that situation to help is their own pediatrician to say, do we believe that there is a benefit for one over the other? But overall, I will say either one will be an acceptable way to use. And Mike, I don't know if you have other, Dr. Brownlee, if you have any other comments.
Yeah, I agree with that 100%. The last thing I would just add, I guess, 2 comments. One is once you start with one, the CDC is recommending to finish your primary series with the same vaccine. So if you get 1 dose of Pfizer, you would need to get the next 2 doses of Pfizer to complete the 3-dose series. So I just want to make sure that that's known. And then here at UI Healthcare, we're actually offering both at the time of the vaccine administration. So to Dr. Boutros's point, have that conversation with your pediatrician. Have it, at least for us, what we're able to offer here, have it in the moment so that you can understand which one is best for your child. And we're offering both at that time of the vaccination appointment. So we just want you to get one of them. So no preference at this time. The data really don't discern a difference between the 2 of them. We're happy to be able to offer both.
Thanks for that information. Let's talk now about some of the logistics. So how will the COVID-19 vaccinations for this age group be scheduled, Dr. Brownlee?
Yeah, I can speak to what we're doing here at UI Healthcare. I do know in the community that almost all of the scheduling is web-based. So either through the electronic health record of an organization or through a web portal. That's the same here for UI Healthcare. You can come in through MyChart, which is our connection to our electronic health record, or you can go through uihc.org. We've added those links so that you can understand how to access our system to schedule an appointment. We try to make it as easy as possible. We know not everyone has easy access to electronic format, but we're doing the best we can to make sure that there are open appointments. If you don't have a MyChart account, we've added the link in the comment section. Like I said, we're trying to make as many appointments as available at this time.
Thank you. Dr. Boutros, why are multiple doses of this vaccine necessary? And will this age group need a booster shot?
So I think the vaccine is, would they need a booster shot? Right now, as Dr. Brownlee mentioned, Pfizer is 3 doses, while Moderna is 2. I think there is studies ongoing regarding boosters for the Moderna vaccine. The reason for having multiple injections is really to build immunity and continue to grow that and provide the body the recognition of the virus when they come in. This is not unique for this COVID vaccine. We have seen the same thing. We've done it with polio. We done it with tetanus. With others, we do multiple doses to get the effectiveness that we like to see with the child and preventing them. The other part, I think, we just put the plug that for age 5 to 11, now we have a booster. So I encourage families to schedule if your child have got the vaccine before, but also to help keeping them protected. Did that answer your question, Emily?
Yes, thank you. And thanks for the reminder about the 5 to 11-year-olds as well. Dr. Brownlee, when it's time for a child to receive their second or third vaccine, will they have to get that additional dose at the same location or through the same medical provider?
That's a really good question, especially if you're traveling potentially to get that first dose. The answer really is no. You can get any of your doses from any provider. What we would encourage you to do is make sure you have your vaccine card with you so you can stay within the vaccine series that you started with. So for example, if you started with Pfizer, stay with Pfizer. If you started with Moderna, stay with Moderna. If you forget your card, we can help you look it up here. If you have MyChart, you can also look up that information as well. But like I said, we want to make sure that you're getting the vaccine that you were started with. The other point I'd like to make too is how important it is to get your second and possibly third dose if you had started receiving Pfizer. To Dr. Boutros's point, that's how we're teaching your body to fight off the illness. You need to receive the entire series of the vaccine. The data are very clear that after that second or third dose, you have the maximum amount of immunity. So we encourage you to stick with the series, make sure you track it. But no, you don't have to go to the same place to receive the vaccine. You can go back to your local community, go to your local pharmacy, wherever that may be. But we just encourage you to stick with the series and complete the entire primary series.
Great, thank you. And are there any exceptions where you would not recommend that a child in this age group receive the COVID-19 vaccine?
Yeah, there aren't many, but there are a few. So if your child has a severe allergic reaction to the COVID vaccine, so possibly their first dose, it's very unlikely and contraindicated to receive another dose. There are also some components of the vaccine. One is called PEG, or polyethylene glycol. If you have a severe allergic reaction to that, it's contraindicated. But we encourage you to talk to your provider. There may be some certain scenarios where it may work out to actually receive the vaccine. And there may be some nuances to your history or medical history that we just have to work through. But there are very few contraindications. If you've had serious reaction to other vaccines in the past, we want to know that. So make sure we understand and know. It's not a contraindication to not receive the vaccine, but make sure that you tell your provider, because we want to make sure that if there are any precautions that we're aware of that as we're giving the vaccine. So So talk to your provider. We're happy to help if there are potentially any issues with receiving the vaccine.
One thing I would like to add, Emily, I think Mike covered the contraindication, but also I want the parents to know that if they have special situation and child who is immunocompromised, there might be a different scheduling guidelines for those, and we have that posted on our web. They also can talk to their provider, as well as the CDC have directions on those. So I think we address, if there is any special circumstances, please don't hesitate to talk to the provider. Let the person who is administering the vaccine know, so we can guide you through this process.
Thanks for pointing that out. Appreciate that. So we are going to wrap things up. We just have one final question for you, Dr. Brownlee. We mentioned this a little earlier in the broadcast, but just to recap again, when and where will parents be able to get their kids vaccinated?
Yeah, and thanks for the reminder. And appointments are open right now through MyChart, which is our electronic health record connection here at UI Healthcare and at uihc.org. So we just encourage you to go out and schedule appointments. If you have questions, we're here for you. So we have vaccine available, both Moderna and Pfizer. We know that the community is excited to be able to offer this and really close the loop for all the age ranges now that are eligible to receive the COVID-19 vaccine.
Thank you.
And Emily, I had the plug is, again, please don't hesitate to talk to your pediatricians. Even if you feel like I'm not sure, we are a partner in this journey, and our goal is to help you and guide you through this process. So please don't hesitate to reach out and ask questions and any concerns you have on your mind. That's what we want to put you at ease.
Thanks, Dr. Boutros. And Dr. Brownlee, any final remarks from you, or Dr. Boutros, any other or final remarks that you really want people to take away from today?
Yeah, I just want to continue to reiterate we're here for the community. We're excited that we now can offer this for full family protection. And it is important. We know that right now that it's not perceived that COVID is an issue, but we need to remember there may be additional waves in the future in the fall. And so protection now will protect you into the future. So don't be misled maybe where the state of COVID is at this time. Potentially think ahead, and our providers and our team, as Dr. Boutros had mentioned, can help walk you through what that might look like and the impact on your family. So once again, we're grateful to offer appointments. You can go in through our web portal or through MyChart, and we're here for the community with vaccine for these kids now 6 months and over. Dr. Boutros, any last comments?
The only thing I will say is please take this and consider it much. I know we still think that probably kids is less affected by COVID. However, we know that there are outcomes that we don't like to see with our kids, and any opportunity for us to minimize hospitalization, severe disease with the kids is a great opportunity. We want our children to grow and grow healthy. So please take this as an important thing to consider.
Thank you both. Those are great points to end on. We really appreciate you taking the time to share that information with all of us and help educate us to make informed decisions. And thanks to everybody who tuned in to join us as well. If you joined in the middle of our broadcast, make sure to go back to the beginning so you can hear all the great information our experts provided. Stay tuned to our social media channels and our website, uihc.org, for all the latest COVID-19 and vaccine information as we have it. And lastly, remember to get your COVID-19 vaccine, practice safety precautions, and take good care of your physical and mental health. Thanks for watching.
Thank you.
Thank you.